you for that kind introduction, Maheen, and I'm very glad that everybody's here on Mental Health Awareness Month. Now, I'd like to start with, since we are talking about the awareness of mental health, we should have the basics of mental illness. So what is mental illness? Mental illness includes a wide range of disorder of thinking, emotion, or behavior. So there are many types of mental illness. It can be short-lived or long-term. Sometimes it can be hard to tell the difference between mental illness and normal worry or sadness. But mental illness is more severe. It lasts longer and significantly affects a person's ability to cope with life. Almost half of adults experience mental illness at some point, and depression is very common. The main treatments before were medicine and counseling or talk therapy. Family, friends, and support groups, as mentioned by Ms. Altsma, can help people cope with mental illness. Now, what are the types of mental illness? There are really many different disorders. They fall into different categories, including anxiety, mood disorders, such as being too sad, like depression, or being too excited, like mania, schizophrenia, personality disorders, obsessive compulsive disorders, and other mental health disorders, including eating disorders, stress disorders, such as PTSD, and suicidal behavior, which has increased ever since this couple of years. Now, what causes mental illness? It is probably caused by many things in combination, including inherited factors. It runs in families, life stresses, the environment and culture you live in, health problems that affect your brain, many stresses such as losing a job, getting divorced, or taking too many drugs increase the risk of mental illness. Certain health problems can affect the baby's brain, such as complications during birth or a brain infection by a virus like encephalitis. They increase the risk of mental illness later in life. So mental illness does not occur because people are lazy or irresponsible. It's not something that people do on purpose. So what are the symptoms of mental illness? Symptoms are different depending on what kind of problem you have. Symptoms may include major changes in personality or behavior, especially if they happen for no clear reason. Confusion and cloudy thinking, odd, disorganized thoughts, such as jumping from topic to topic or answering simple questions with long, confusing answers. Inappropriate behavior, such as undressing in public, seeing or hearing things that aren't there, called hallucinations, believing things that aren't true, despite strong evidence to the contrary, extreme moods. So how can doctors tell if someone has mental illness? Doctors diagnose mental illness by talking to the persons. Sometimes they also talk to the caregivers and family members. Sometimes it's obvious that some symptoms that the patient has mental illness. For example, people insisting that they are the president or that their thoughts are being controlled by a radio implanted in their brain. Other times, it's hard to distinguish mental illness from normal reactions. For example, it can be hard to tell normal grief from depression after the death of a spouse or a child, because both involve sadness and a depressed mood. Likewise, the line being neat or orderly and having obsessive compulsive disorder can be blurry. So any dividing line can be based on the following: how severe the symptoms are, how long the symptoms last, and how much symptoms affect the ability to function. So how do doctors treat mental illness? Doctors have made a great deal of progress in successfully treating mental illness. The main treatments include talk therapy or counseling and medicine for some. For most mental health disorders, A combination is more effective than either one by itself. There are other modes or alternative treatment of mental health diseases, and I leave it to my colleague, Dr. Welland, to discuss it. In the past, people with mental illness were often placed in institutions or hospitals. Today, people are more likely to live productively in the community. But many people with mental illness still don't get the care and support they need. I bet you have heard of the concept of Ho'oponopono, which means cause things to move back into balance. But in case you haven't heard the story behind it, let me take a moment to share it with you. A therapist, Dr. Ehalekala Yulan, was able to cure every single patient in the ward for the criminally insane in Hawaii's state hospital. And he accomplished this in a truly miraculous way. He never even spoke to one single patient. He stayed in his office, looked at his patients' files, and worked on himself instead. He spent each day as he looked at each of their files, looked at their photos, repeating the words, "I am sorry, please forgive me, thank you, I love you," again and again. Now, what is he trying to do? He's trying to send energy to all these patients in the ward. A very, very strong, very strong emotions coming from his heart. All of the patients began making progress after a few months. And some who had been shackled improved to the point where they no longer needed to be confined. Patients on medications no longer needed them. And even the patients who had been considered hopeless were healed eventually. In addition, the staff who had formerly hated their jobs now began loving to come to work each day. Dr. Yulen passed away on January 15, 2022, and left us with an essential message. The only purpose in your life and mine is the restoration of our identity, our mind back to its original state of void or zero, of purity of heart, and of blank page through non-stop cleaning. In other words, our purpose is to restore balance. And because everything is connected, we have the ability to heal not only ourselves, but also everyone around us. Now, I want to share with you another person's perspective on how we are all connected. Neville Goddard. Neville was born in 1905 and was an author on the subject of manifestation. He had this powerful philosophy called "everyone is you pushed out." The concept is that we are each like facets of a diamond that in whole comprises the totality of God, or the all that is. God became invisible and resides in each of us. And each of us is the operant creator of our own world. One way he explained this is the analogy of an unfertilized egg. The egg is solid and impenetrable up to the second of fertilization by a sperm, and becomes impenetrable the second after fertilization. Each state of consciousness that exists is like an unfertilized egg until it is fertilized by our consciousness. When I read about this, a powerful thought hit me like a lightning bolt. Our feminine consciousness is creating a spark of masculine creator energy as a thought form that can unfold an entirely new world. This tiny bit of masculine energy residing in our feminine energy of consciousness is like the dot in the taijutsu, which is commonly known as the yin-yang symbol. The dot on each side of the taijutsu is the spark of creation, and it helps to restore balance, as Dr. Ihaleakala Yulen stated is our purpose. With our thoughts and emotions together, we are able to create more balance, not only in our lives, but in the world around us. We have the power within us to influence and shape the world around us, including money. Emotions are far more powerful than our thoughts. And as I'm sure you know, love is the most powerful emotion of all. So let us spread love, kindness, care, consideration, and understanding to all our fellow men. And hopefully we can help conquer mental anxiety all over the world. Thank you very much. And God bless everyone.